Hi there, Andrew with Zang Physical Therapy here. And in medicine today, often we don't get exactly what we want when we want it. We have to wait days to get an appointment. Uh, we then have to wait um, half an hour in a waiting room to see the physician that you wanted to. Then you're waiting to, maybe get imaging. You're waiting to get in to see maybe a rehab provider, and it just goes on and on. And you're seeking some kind of help for a problem that you're having, be it shoulder, knee, back, neck, whatever it is. And all you want is to feel better. And there remain barriers in your way. And this doesn't have to be physical health, musculoskeletal health, which is what I deal with. And this could be if you have a cold that you're trying to get seen, which is why we have urgent cares trying to get you in faster versus waiting days to get in your doctor so you can get some antibiotics so you can feel better. In the musculoskeletal realm, why see this? People wait days, they wait weeks, they wait months to try to get an issue resolved because they don't want to go through the hassle. And the longer people wait to deal with an issue, the more difficult it becomes to get that issue to feel better because they've avoided activity, so their muscles learn not to move there. Their body becomes deconditioned to that movement so that when they go and try to do that movement again, it's either more difficult or they fatigue faster and can't do it as long. They get stiff, and all that leads to more aching or discomfort or pain or whatever word you choose to put to it. And that does nobody any good. It leaves the individual has aches and pains frustrated because they haven't gotten help fast enough. It leaves the provider frustrated because they're trying to help a situation, and sometimes we do a bad job of educating people on expectations. So some of that goes on us, and we need to educate the person how they're going to get there. And it's not always going to be when you want it. It's going to take time. But what if you could get what you want when you want? And so in order to get what you want when you want, it's a little bit of give and take. So the individual who wants something has to give up and make the decision sooner that they want help. The provider needs to step up to the plate and offer available times for the client. And throughout most of the medical industry, from the provider standpoint, that just isn't there. But as I spoke about the other day, there are concierge physicians, there are concierge therapists that are out there that we get people in much faster. All it takes is a phone call. And right before I jumped on here, I got off the phone with a wonderful young man. I don't know if I should say young. He's actually a little bit older than me, but I got off with a nice gentleman. And, he had been around the block. He's been a very active individual his whole life. He's been beat up with various injuries. But it's all in pursuit of what he enjoys, activities, what he enjoys. And right now he can't do that because of an injury and a surgery he had. And so he's gone through the medical system, and he waited days to get a surgery that probably should have happened many days before because he needed a certain type of physician to do the surgery because it was a little bit more technical. And then as he's gone through the rehab process with somebody else, he's been highly dissatisfied because they haven't listened to him, and it's causing him a lot of trouble. So as he put it to me, he said, months ago I saw your pamphlet in another provider's office where I was because he seeks more holistic stuff. So he saw it there, and he found it interesting. And as he's been getting frustrated with the other provider not listening and giving him what he wants and needs, he remembered seeing my pamphlet. And we spoke for probably a good 20 or even 30 minutes right before I jumped on. We had a great talk about everything he wants and everything that he needs so he can get back to enjoying the active lifestyle. He wants to go out to the outdoors and do everything. Bike, hike, climb, run, swim, you name it. If it's outdoors, he's involved in it. He loves it. So what we talked about was, he told me everything that he wanted. We talked about everything that, he could potentially get. It's trade-offs. So to get what you want, sometimes you have to give a little bit. So that's what we talked about. So in healthcare, it's just something that isn't talked about much, but we should. You know, everybody out there is a consumer of something. You know, if you go for anything you want in life, you know, you go out there and you decide what you want and you do what's needed to go get it. But we need to do that with our bodies too. You know, we need to treat our bodies well. We need to keep them healthy. We need to keep them tuned up. So when you want something, what are you willing to do to get it? Are you willing to give up something to get what you want? If you are, then there are plenty of providers out there who can accommodate your needs. If you're willing to stay in a narrow box, then your options are going to be a little bit limited. So get what you want when you want it. It's out there. I'm happy to continue this conversation with anybody who wants to. But my goal in what I do is to help people get what they want as quickly as they can, get them back to enjoying life on their terms as much as possible. So if this is something that you're interested in, please leave me a comment, send me an email, andrew@zangpt.com, send me a private message, you know, give me a phone call. We can chat, talk about your needs and your wants and your desires, and we can try to set a plan to help you reach it. Alrighty? Hope you have a pleasant day.